Hemochromatosis is more prevalent than you'd think. And you may be thinking to yourself, well, I don't have hemochromatosis. Please temporarily consider that a less than clinical value of iron in the tissue is enough to enact damage. Approximately 1 in 200 individuals of Northern European descent are homozygous for the hemochromatosis mutant allele. Even with the prevalence of the HFE hemochromatosis gene, homozygous inheritance does not always result in clinical disease, and heterozygous inheritance of only a single defective gene may result in increased iron stores. Yet neither homozygous nor heterozygous inheritance guarantees a clinical manifestation of the disease itself. In detecting hemochromatosis, doctors are looking at your blood levels of ferritin and transferrin, the chaperones responsible for moving iron throughout the body. The logic is that chaperones would only be there in the presence of what they were supposed to be chaperoning. Only looking for chaperones, however, is an incomplete method, and there is an important distinction physiologically between iron in the blood and iron in the tissue. Might there be something going on below the surface biomarkers of iron in the blood? An estimated 16 million Americans have some degree of iron overload, either inherited or acquired. 3 out of every 4, a whopping 75% of those 16 million, are asymptomatic of the typical symptoms associated with hemochromatosis. And an incredible 50% of those who are diagnosed hemochromatic go on to develop either type 1 or type 2 diabetes. One can't help but imagine that with 75% of the known people with iron overload being asymptomatic, that leaves plenty of room for more undiagnosed people. Might there be a gradient of complications as the body accumulates and experiences degrees of iron-loaded tissues? These patients, most likely suffering the effects of tissue oxidation, are being treated for their respective symptoms in isolation with no documentation of their iron status. These statistics don't even take into account the fact that there are other noted types of iron overload, independent of the classic hemochromatosis HFE gene. There also exists an insulin resistance-associated hepatic iron overload, or IRHIO. One does not have to stretch their imagination far to see that there is a potential for a significant number of undiagnosed HFE gene-carrying and non-gene-carrying iron-overloaded patients. These people present with a myriad of conditions, all secondary to the inflammation ignited by iron-overloaded tissue. This leaves so many of our current diagnoses and treatments being prescribed for secondary symptoms.